Yes.
Congressman Ruiz, thank you for joining us.
It's good to be here.
I'd like to start by asking you about when things should begin to reopen here. Earlier, I spoke with the mayor of Palm Desert, who says most people can and should go back to work, and that the longer we wait, the more businesses and jobs will be lost. Do you agree with her?
No, I don't agree with her. I believe that science should dictate when we start to open up, and we should also make sure that we have all the protection measures in place before we do, because if we open up too early, then we run the risk of another flare-up, which would only delay our economic return, and that will only hurt us more economically. So the criteria that we need to ensure is, one, that our hospitals have everything in place so that they can handle a flare-up. Two is that we have ample testing in order to rapidly identify new cases. Three is to be able to isolate them and do contact tracing and quarantine individuals who are at high risk. Right now, we don't even know if we've reached the plateau of the transmission curve. So it'll be too early to make that decision, and too dangerous to do it without the appropriate safeguards.
And I know it's hard to pick an exact date on when the reopening could happen, and I'm sure you're getting asked this all the time by your constituents, so forgive us. But do you have a general idea? Are we talking the end of May, maybe June, or later in the year?
Well, first we need to practice stay at home and washing our hands as much as possible. We shouldn't be easing up our stay at home proposals just yet, because the slower we can decrease, or the faster we can slow the transmission of the virus, the sooner we can get to that point. Then we have to work aggressively to make sure that we have ample tests, that we hire individuals to do contact tracing, so that we can create the precautions and safeguards needed to then start to regionally and very targeted easing the stay-at-home precautions, and also opening up non-essential businesses. And then when we do open non-essential business, we need to ensure that the businesses practice the social distancing necessary, because the virus is not going away. The virus will still be here until we have the vaccine. Therefore, we need to make sure that when we go back to a semi-normal, that the semi-normal way ensures that the elderly and those with underlying illnesses don't get sick and die, that we don't have another outbreak, that we ensure our healthcare has the capacity to handle a surge, and that we're quickly able to identify new cases. Without that, then we're just pushing the system. And what we're seeing in Singapore and other locations in South Korea that actually did a very good job of containing is that if they ease the precautions too early, you're actually seeing another bump and another flare-up, and we can't afford that economically.
And along those lines, golf courses could soon reopen in Riverside County, but with certain restrictions if the county approves an amended order. Your thoughts on that?
Well, I would like the county to explain if we've reached the criteria that the state or even the criteria that the White House task force have laid out. In other words, how do we know for sure that, one, our hospital is equipped to handle a massive surge? Two, do we have enough personnel in place to do contact tracing and quarantining? Three, do we have enough tests in place in order to quickly identify new cases? Because if the county starts to relieve the precautions for golf courses, then essentially they're declaring that we're ready in a scientific public health perspective to ease the protections and the precautions. And so those are questions I want to hear from any leader who is urging the decrease of precautions that keep our community safe, are show me the parameters that we've reached to reassure not only other doctors that are working in the front line and nurses, but our constituents. You know, we all want to get back to work. We all want to make sure that kids go back to school, and constituents are suffering right now. But I go back to the initial statements that the public health experts are saying, that the depth and the length of our economic recession, of the economic pain that we're feeling, is related directly to the spread of this virus and the damage that the virus is having on our public's health. So it's not contradictory that in order for us to get ourselves back to work and to minimize the length of economic pain that our small businesses and our communities are facing, we need to get this right, and we need to take care of the virus and protect our constituents' public's health and ensure that we save lives. And that's a continuum. It's part of the equation. You can't have one without the other. So I understand that we need to help. Now let's work together to build the criteria needed to create the precautions so that we can start to safely open non-essential businesses, get kids back to school, and provide as much support as we can to our constituents who are going through a hard time.
Last question. Do you think there's a good possibility that Coachella and Stagecoach may not be happening in October after all?
Yeah, there is that possibility, because we know that the virus is still going to be around, not just here in the Coachella Valley, but throughout the whole country. We also know that we're going, if those concerts continue, and that we ease the traveling restrictions and stay-at-home precautions, then you will see tens of thousands of people coming to the Coachella Valley, which is already a very vulnerable area. So this is the time to start preparing to ensure that we have ample testing, that we create safeguards in order to identify quickly, isolate those that may be at risk or that have the virus, to provide support for them to be able to self-quarantine away from their families if people here get sick, and to ensure that our TSA workers, our airline workers, our concert workers, our grocery store workers, our frontline workers are safe from individuals that will now be at higher density. You know, that's a unique problem for the Coachella Valley when we're one of the more vulnerable locations for people dying given our demographics. So right now is the time to create that plan, and I'd like to be able to learn from the county what they're doing in that regards.
Congressman Ruiz, thank you so much for joining us.
Thank you.